So almost 300 medical interns are still in limbo over their placement at various public hospitals across South Africa. Frustrated at the lack of communication from the health department, the young medics took to social media, and that was to raise their concerns. When #unemployed_doctor trended across the country, the medics were eventually told that the department has funds for only some of them to be placed. The South African Medical Association has since slammed the department over what they're calling failure to resolve an annual issue. For more on this now, let's bring in SAMA Deputy Chair, Dr. Mvuyisi, who joins us via our video link. Doc, it's great to chat to you. Thanks very much indeed for making time for us on this program. Let me start with what I've mentioned and attributed to your organization. It feels like we've been here not once, not twice, but several times. Why is this a recurring problem that we're unable to solve?
Well, good morning, Ayanda, and to your viewers. Thanks for having someone in your program. Ayanda, it's very disappointing, and also it makes us, very unhappy that after so many years, the Department of Health seems to be struggling with this very simple issue. Even at the point where we offered our assistance to the department in many years, even with their appeals program. You must understand that this internship program was initiated and legislated by government. After years of medical school, you need at least 2 years doing your internship. You can't do anything if you haven't done your internship and your community service deployments. Now it is expected that government would twice in a year allocate interns and communicate with interns timelessly. But this is not what we see at the moment. We're seeing frustrations, we're seeing confusion. After many years, it's a yearly occurrence, like you said in your introduction, and we don't understand why they cannot fine-tune this process that has been with them for such a long period of time. And SAMA has been assisting, Judaza has been assisting, because what we've been doing is to collect the names of interns that are not placed to submit to the Department of Health. We don't understand why they are still struggling. And I mean, in a pandemic also, that you've got these bureaucratic processes that are not flexible. Even during the pandemic, you still want to wait for January and July for placement of interns, when there's a dire shortage of doctors, especially in provinces where they are hard hit by this pandemic.
That really preempts my next question. Have we come any closer to understanding the scale of the lost opportunity here? It's unthinkable in my mind for the government to have any kind of medical assistance wasted like this.
That's a very important point that you are raising. You must remember, you are not only training interns within the South African borders. We also take interns, medical students to Cuba for training, and we bring them back. The understanding is that we have a shortage of healthcare professionals, doctors in particular, in the country. But that's what you see in the country at the moment. Because what we see is provinces not allocating posts, not availing those posts to the national department. We know that Treasury does give money to the provinces, but you must remember that they can do whatever they want to do with the money that is given. Our healthcare system is not a well-coordinated system, I must tell you. It's a very fragmented system where you have a national Department of Health having nothing to do with provinces. Provinces, even MECs, they report to the Premier. They have nothing to do with the National Minister of Health, or there's no coordination. You've got another wing that is also hanging there, the municipalities. So what I'm saying is that we are not surprised that there is this confusion, because this is what has been our experience in the Department of Health. So this problem is going to cost us, is still costing us. You've got interns who've been trained, with taxpayers' money. They are sitting down at home. They are frustrated and during a pandemic.
Right. We're told in part that government is trying to address this. Some of the figures at my disposal are as follows. Apparently 118 medical graduates will now be taken up from July. We're told that funds have been allocated to this end. But still, 214 others have matters still outstanding. What do you know about the response from government, given the furore we've seen even on social media?
Well, what we've been told today that there's a meeting. I think that meeting must be fruitful, because if that meeting is not fruitful, we are prepared to assist those interns to take government to court, because they have legislated the internship, medical internship. If they cannot really place those eligible interns in their posts, we are going to assist them to take them to court and deal with them accordingly. Today's meeting must really be fruitful. Otherwise, we're going to meet them in court.
And what does fruitful look or sound like to you? Are you hoping for a plan from government of people to be placed in the future? Or do you think that time has passed, that these interns should be given placements even at that meeting?
At that meeting, it must come out with a resolution that all interns are absorbed in the system. Those that are eligible are waiting to be placed in this July cycle. They must be, all of them, they must be placed, especially if they qualify like we understand it. So that is why we're saying this time around, we're not playing games. We've been assisting government with our own resources, by the way, assisting government to fine-tune this process. But that's not what we are getting. This time around, we're not going to assist. We're going to take them to court if they cannot place the interns.
Who is going to be at that meeting, to your knowledge, Doc?
Our knowledge is that in that meeting there will be the National Department of Health. I think one of the guys will be there is Victor Kanyile, and I'm sure the provinces as well will be represented, and Treasury who should be there to deal with this matter and be solved as soon as we can.
I'm asking because I'm wondering where the voice of the medical interns themselves is as these discussions continue. The reason why I wonder about that is I can imagine a situation where this kind of frustration might lead to people deciding to actually leave the profession itself. From your own evaluation, is something like that actually happening? Do you have an idea of how many people might actually be lost to the system because of these dysfunctionalities, if that's even a word?
Yeah, that's a very important question you're raising. The losing professionals from our side is not a new phenomenon. I mean, these frustrations have made the profession to lose quite a lot of professionals to other professions. For example, we've got doctors who are now artists. We've got doctors who are now business people because they decided to leave. Some actually are in other countries, in Canada, in the UK and all these other areas, because they've been frustrated by our system. So this is going to cost us, because people are going to look for other opportunities. That is what is going to happen. In this meeting today, there's no expectation that there should be interns inside the meeting. But what we are saying is that that meeting should not decide any other thing other than placing interns.
Sure. I wonder what the solutions look like in the future, though. I'm willing to bet the little money I have that we'll be here having this discussion again this time next year. Have you, perhaps in your line of work, been able to even just theoretically put together what an alternative would look like? I mean, is it possible, for instance, to have universities oversee the process of placing interns? Is it possible to have hospitals given incentives to have medical interns within the institutions with the hopes that those kind of strategies might iron out some of these, again, dysfunctionalities?
Well, I think there are many things that need to be considered. In fact, medical deans are part of the frustration, by the way, because they're supposed to be supplying to the Department of Health, submitting reliable numbers to say this year we've got so many people who are supposed to be qualifying, we've got these people who have qualified, and we've got these who are doing, who did not make it, maybe because their parents got sick or they themselves got sick. There's many challenges that face people when they're studying. So they need to submit that reliable information to the Department of Health. But what we need to do also, is to have maybe rope in as well the private sector to see what role, because they are benefiting from the training of doctors, what role can they play in terms of the private hospitals accommodating interns. I think that's a discussion that we need to have, whether we like it or not. Government alone is not going to make it.
Dr. Mvuyisi Mzukwa, thanks very much indeed for your take on this really troubling issue. Again, unthinkable that any kind of medical assistance could be lost to the system, even in the midst of a global health crisis.